Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, 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 you guys. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder that I always go over that is we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos that you may see that I may talk about things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner and NP student are discussing policies. A policy covering claims that arise out of damage or injury that took place during the policy period, regardless of when claims are made. What policy are they discussing? Is it A, a claims based policy, B, an occurrence based policy, C, an HMO, or D, a PPO? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is really being asked of you. So here, the stem of the question states, what policy are they discussing? So we got to run it back and see what we're even talking about, what the scenario is providing, and see what they have described about a policy, right? So the nurse practitioner and NP student are discussing policies. Says that a policy covering claims that arise out of damage or injury that took place during the policy period, regardless of when the claims are made. So, all right, so when we're thinking of policies that one may have, there's very much some specifics. And so here we're talking about a policy that covers your claim regardless of when the claim is made, right? So that is B, an occurrence based policy. An occurrence based policy covers you as long as you had a policy when it occurred. So, regardless when they file the claim, as long as you had a policy in place when the incident occurred that the claim is referring to, then you're covered. So, if you had an occurrence based policy in 2020, and it's now 2024 and a claim is being filed on something that occurred during 2020 in the pandemic time, then with an occurrence-based policy, you are still covered because you had an occurrence-based policy during the period that it occurred. Claims-based is the opposite of that. You have to have a policy in effect when the claim is filed. It's based upon the claim. Occurrence based is based upon the occurrence of the incident. Okay. All right. Question number two. A federal government funded healthcare plan that supports low income populations with long term medical expenses. What healthcare plan is this? Is it A, COBRA, B, Medicare, C, Medicaid, or D, Medicare Part A? Take a moment and tell me what you got. So, stem of the question, what healthcare plan is this? All right, so let's see what they're talking about. A federal government funded healthcare plan that supports low income populations with long term medical expenses. And again, I always say with non clinical information for board's purposes, most of these things are definitions. It's not going to change. It's not going to vary. So you need to know the term. You need to know the definition so you can quickly identify it. Okay. Because honestly, I know we say that, a lot of people get flustered on this, but these should be things that you should easily get because it's not going to waver. You know what I mean? It's going to just be simply the term and definition. They just may put it in a scenario. So make sure you know the definition so you're not missing the ones that are straightforward. Okay. But we should know that is C, Medicaid. Medicaid, is a federally funded plan for low income individuals and families to aid and assist with medical expenses. All right. And lastly, question number 3 for today. The nurse practitioner and NP student are discussing insurance coverage. The NP student inquires about which type of plan provides coverage for providers in a specific network. Is it A, Medicare Part B? Is it B, Medicaid? C, PPO? Or D, an HMO? Take a moment and tell me what you got. All right, and similar question here says, the MP student inquires about which type of plan provides coverage for providers in a specific network. And this is an example of how the stem of the question is really telling you what you really need to know. It is the question, right? And so they were discussing insurance coverages, but the MP student is inquiring about which one provides coverage for providers in a specific network. So this is D and HMO. With HMOs, that particular insurance plan, we know covers specifically certain providers in the network. So when you are scheduling or finding a provider, you're supposed to select from that network, the providers in that network to get the coverage that is included in your insurance plan, right? Whereas a PPO, the preferred provider option, it doesn't have to be a specific one in the network. You're able to select like a PCP, whatever provider that you decide upon, because it is a PPO. It's your preferred provider. It doesn't have to be in that specific network. Okay. So here the answer is D and HMO. All right, you guys. I continue to keep the non-clinical things going. I hope this is helping you guys. But as always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. And if you have any questions or would like any of the resources that I offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number 1, at gmail.com. Things that I do offer, I have a review book option. It is either in the ebook option or the paperback option. Both are linked in the bio of this channel. I do offer an independent self-paced review for family and adult GERO, preparing for both exams, the AANP as well as ANCC. It does include a non-clinical section to prepare you for that substantial portion on the ANCC exam. It is self-paced. It is independent. You can listen to it as many times as you like. It is videos broken down by system, and that is also linked in the bio of this channel. The 5-week group review will be up and coming in September, so be on the lookout for the enrollment links coming soon. And then if you are interested in any of our one-on-one sessions, I offer these in 3 different tier options. One-on-one sessions, you can book sessions just to cover 1 to 2 weaknesses that you may struggle with. You can book an exam readiness assessment, or you can book our custom one-on-one package plan, which is most commonly the popular plan, because what we do is you're provided with a pretest to gauge exactly where you are. And based upon the time that you are looking to review, we structure a study plan specific to you and your needs and where you are. I work alongside with you during that time and take you to a successful exam attempt. And then lastly, I do still have 1 remaining VIP session for August and September. It will start August the 5th. It is an 8-week VIP plan. And this is more typically for individuals who have maybe struggled with passing boards, needing a little bit more detailed structure and someone to work alongside with them for 8 weeks versus a 5-week or individual resource or booking, various sessions. It's the full thing from start to finish over an extended period of time. So that's something you're interested in. Feel free to reach out to us. But as always, y'all make sure to meet me back here. Happy studying. Bye, y'all.